Hi everyone, it's me, Dr. Sarah Sadek. Welcome back. Today's video is all about 10 things you need to know about your Invisalign attachments. If you have Invisalign or you're planning to have Invisalign, then you will have heard that you need something called attachments. These are tiny buttons that are placed onto your teeth. They're made of a composite material similar to the ones that we use for fillings in your teeth when you have a cavity. What the attachments do is they allow your treatment to progress more efficiently and effectively, and they allow forces to be applied onto the teeth in a specific direction, and they can also control the amount of force that's applied onto a tooth. They can vary in their shape, in their size, and the angle at which we attach them onto your teeth, and this all helps in specifying the tooth movement that we want for a specific tooth. So here are 10 top things that you need to know about your Invisalign attachments. Number 1, now the first thing you need to know is that these attachments are tiny. When you think about how big a tooth is, so if we have a look at this tooth model here, a tooth's length is about 9 millimeters. Now an Invisalign attachment will cover just a tiny surface of that tooth. Attachments are usually about 2 to 3 millimeters in diameter, so they are tiny. But as with anything in your mouth, you will notice this: if you have a seed stuck in your tooth, it feels huge. And that's the same with attachments. They feel huge, but actually they're tiny. They're little teeth-colored dots. Literally, that's all they are, teeth-colored dots that we attach onto your teeth to allow the aligners to move your teeth more effectively. Number 2, location, location, location. Location is everything when it comes to these tiny attachments. Invisalign attachments are usually placed on the center of your tooth, but sometimes they can be placed slightly further up towards the gums and sometimes also to the side slightly. And the position of these attachments will all vary depending on the position of your tooth and how much rotation is needed to be achieved. Number 3, shape can vary. Attachments can be circular, they can be triangular, they can be rectangular, they can be oblong shaped. They can be any shape that's needed to achieve a particular rotation or movement, an intrusion or an extrusion. This is why there is no specific shape for your Invisalign attachments. You may find that on some teeth you have a nice circular attachment, on another tooth you may find you have a slightly larger oblong shaped attachment. Number 4, attachments have a very important job. Now, attachments effectively serve as anchors for your aligners. They will allow your aligners to fit more snugly against your teeth and allow your teeth to move more effectively. And when your aligners fit against your teeth well, it allows your teeth to move well and your treatment will progress more quickly. Number 5, attachments admittedly can be annoying. Now, why are attachments annoying? Because if you didn't have them, you could easily put your aligners in and out with no problem. Having the attachments in place means you have to maneuver them slightly over the attachment, click them into place, unhook them against one attachment to get them out. So it does make things a little bit more annoying, but remember, they are doing a good job. When you have attachments, you do need to make sure that you're cleaning really well because they can increase the buildup of food, debris and plaque around those areas, and they can also cause staining where you have the glue and the composite. They can stain more easily if you have particular foods and drinks such as tea and coffee. So brushing those areas really well where you have the attachments is imperative. Number 6, not every tooth needs an attachment. Now, the number of attachments you have and their positions will vary according to your orthodontist or your dentist that's providing your Invisalign treatment. And generally speaking, not all your teeth will need an attachment. And what sometimes happens is that you may have an attachment placed slightly later on in the treatment and then have it removed afterwards. So sometimes you'll have an attachment placed and removed and have a different one placed. So attachments can change in their locations throughout your treatment. Number 7, sometimes the attachments are obvious and sometimes they're not. If you have attachments on your front teeth, then they're going to be a little bit more obvious than having them, say, on your premolars or your molars. However, your Invisalign provider will do their best to match the attachment color to your natural tooth color so that it blends in as much as possible. Number 8, adding the attachment is really simple. So how are the attachments added? Well, to summarize it, your teeth are prepped with some solutions. We then use a template to attach your attachments onto your teeth using the composite that I spoke about earlier, and this is then set with a blue light, and the attachments are smoothed and buffed and made nice and comfortable for you. Number 9, you may not need any attachments at all. If your treatment is fairly straightforward and you don't need many aligners, then often you won't actually need any attachments at all. And finally, number 10, attachments make Invisalign possible for more patients. So attachments allow tooth movements to be achieved with Invisalign that otherwise wouldn't be possible with just an aligner and no attachments. So if you've got a particularly complex case that has a lot of rotations, then having those attachments in place actually allows the treatment to be possible. There we have it. If the thought of having attachments on your teeth during your Invisalign has put a damper on your excitement of getting Invisalign, don't let it. Invisalign is still very discreet, it's not easy to see, and the attachments do blend in with your natural tooth colour. Your attachments will be hidden by your aligners most of the time, and remember, they do make your treatment more effective and they speed it up. Thank you very much for watching, everyone. I hope you found this video useful. If you have, please do give it a thumbs up. Don't forget to subscribe to my channel by hitting the subscribe button and the notification bell button underneath. If you have any topics that you'd like me to cover, please do leave me a comment in the comment section below. Do you have Invisalign? How do you find your attachments? I'd love to hear from you. Until next time, take care everyone, and I'll see you soon. Keep smiling.